Now, from CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning and welcome to Facing South Florida. Earlier this week, I sat down with Governor Ron DeSantis for his first one-on-one news interview in almost 2 years. The governor has been roundly criticized for his handling of the pandemic and his refusal to issue a statewide mask mandate. There was no limits to our interview, which lasted for an hour. Now, the full interview is available at cbsmiami.com, but this morning we are going to show you some of the key portions, from whether he is tied too closely to President Trump, to the failures of the state's unemployment system and when schools should reopen. I even ask if he believes immigration status should play a factor in who receives the vaccine when it is available. But we start on a more personal note. In the midst of this virus, DeSantis' wife gave birth to their third child. I ask him if he gets much sleep with a newborn in the house.
Well, I'll tell you what, before Mamie was born, we have two others, and my wife was deputized by the Gadsden County Sheriff, and that's good for a year, and she has used that to keep law and order around our house because our 3-year-old's running around, our 2-year-old. Mamie's 4 months. She is very happy. Great baby, but we've basically, as a family, been at the mansion since the pandemic started, and so I'd like to, when we settles down, to be able to get the kids out and be able to do some stuff.
Does she get nervous when you are traveling around the state at all, when you come home at night?
No, it's all good. We've talked about it. We were so busy in January, February, we think to ourselves, we may have even had this thing, when it was going around with that. But no, it's all good. And, she's doing a great job because it's very difficult circumstances. And so, I'm living proof of, what these spouses have done with having to do the schooling. Now, our kids are in school age, but you go back from mid-March and people's worlds have been turned upside down. And, we see that to a certain extent in our household. And I know many Floridians have had to deal with that as well.
Well, we'll talk more about that, but let's get an assessment. Last week was the deadliest week that the state of Florida had. I think 4 of the days last week they set records. We set records on the number of deaths. Where do you see things today?
Well, one, I think it was a rough week to have those reports. I would say, though, that when they're reporting, that's not that the fatalities necessarily occurred. They've been kind of occurring. We know when we started to see the surge of people going into the EDs, the hospitalizations increased. Then unfortunately, we were going to see some painful outcomes. Although I will say, if you look at the recovery rates, comparing Florida to some other places that have been hit, people are actually recovering too. And I think that story doesn't always get out there. You'll have people who will end up in intensive care where had they been in northern Italy 4 months ago, probably wouldn't have a chance. Those people are now walking out of the hospital. So I think our medical folks have done a phenomenal job. Obviously, every life counts and we mourn every death. But I really do believe that without their expertise, and then I think also Florida's done a good job of protecting the most vulnerable, we would have seen worse outcomes. And so the recoveries have improved over the last 4 months. But I think the general trajectory, when you look at kind of what the leading indicators are, to me, the number one indicator that I look at is how many people are showing up to the emergency department with COVID-like symptoms. Because these test results, it's a matter when the labs dump them on us. Sometimes these results are from 2 weeks ago. We just don't know. But those ED visits are really key because that's somebody that is going to the emergency department. We saw those increasing. So all of May, beginning of June, we were very flat on that, below where any indicators. Then we started to go up at the end of June, and then we peaked on the week of July 7th. Some counties peaked before that, some a little after, but basically right in there. We're down pretty significantly from that peak. And then I think you've also seen the hospital census with COVID-like illness patients. That has declined. Even in Miami-Dade, it's declined. The admissions have slowed. The discharges are increasing. So those are good trends. We obviously want that to continue.
Let's talk about some specifics, some of the criticisms that you face, so you have a chance to address them. There's an overall impression, I think, that's been struck that you seem beholden to the Trump administration to follow policy along his line. The Washington Post referred to it recently as that you are tethered at every stage to the Trump administration. How do you respond?
First of all, that's just a phony narrative. They were trying to say some of the decisions I made had something to do. I had no contact on a lot of these decisions. So we're doing what's best for Florida. I will say that they've been a great ally for Florida. I mean, when we've needed help, so for example, some of the hospitals were running low on the remdesivir, which is a therapeutic, because, we had a lot of hospital admissions a couple weeks ago. And there's a big bureaucratic process involved with that. I was able to pick up the phone, call the president, and say, Mr. President, I know they're supposed to come a week from now. I need it in 3 days. And guess what? They showed up in 3 days, and we've been able to get support. So I think it's been a good relationship. But in terms of the policy decisions, those are decisions that we're making locally. And I would note, I've worked collaboratively with a lot of the local communities. So southern Florida counties have approached it a little bit different. I've supported empowering them doing that. And then obviously other parts of the state may have a different view. So, it's been very flexible. It's been bottom up. It's absolutely not been dictated by Washington.
I want to give you a chance to respond to another thing that was recently in the press. The Sun Sentinel ran an editorial, "Help us out, Governor DeSantis. We're dying here." And they wrote, "Your daily upbeat message is at odds with what Floridians are going through." Do you think that you have tended to try to find positive elements at the risk of sounding out of touch?
Absolutely not. I mean, first of all, everything that's presented typically is presented negative. So there's a lot of negative that people have. And I've always said that this is,
but from you?
Well, right. So I've always said it. I've always talked about this being a serious challenge. When we saw the increases in hospitalizations, we surged personnel down. We're getting remdesivir. We're always responsive to what's going on, and we understand what families are going through. I mean, for example, some of the protective measures we've done with nursing homes. That has saved lives because we've kept virus from spreading more than it would have. But we haven't had visitation for these folks since the middle of March. That has a huge human cost to families who just would like to be able to have that human contact. So I understand how difficult the situation is, but I think there's also the question, do you want to be in a defeatist posture, or do you want to be in a posture that say, you know what, we're Americans, we can handle this, we've handled difficult things before, we are going to get through this, and we shouldn't let fear overcome our sense of purpose. So it's a serious issue. But I just think that for me to always say the sky is going to fall, rather than tell people, yes, there is a light at the end of the tunnel. Hang in there. Keep doing what you're doing. A lot of people have worked very hard over the months. Social distancing, hygiene, face masks, the elderly, doing a lot to isolate themselves from risk. That's not easy to do.
A cynic might say that your change of tone matches the fact that your poll numbers have dropped.
I've not taken a poll since I've been governor, believe it or not. So I didn't care about them when they're there. As a leader, you've got to lead. And particularly at a time when there's a lot of fear and apprehension, obviously it's being driven in certain directions. There's a lot of partisanship.
Well, let's talk about that moment that has stood out that you've been dumped on for, which is that press availability you had with the vice president on May 20th.
You got a lot of people in your profession who waxed poetically for weeks and weeks about how Florida was going to be just like New York. Wait 2 weeks, Florida's going to be next. Just like Italy, wait 2 weeks. Well, hell, we're 8 weeks away from that, and it hasn't happened.
When you watch that, or when you see your words repeated back, do you admit probably wasn't your best moment, and probably let your frustration and anger get to you a little bit?
Well, here's the thing. I mean, I would say this. I don't mind people dumping on me. That goes with the territory. One of the things that has frustrated me, though, is there's ways to present things that have context and perspective, and then there's ways to present things that cause people to get really, really scared and frightened. And I think there's been a lot of the latter. I don't think that there's been as much of the former. And so my frustration has been, people, man, some of these channels you watch, you just want to go hide in the closet because it's so doom and gloom. So I just wish some of this stuff had a little bit more context, a little bit more perspective, because I think folks would be able to, to have a good handle on some of this.
You said before that the numbers on May 20th were good, and in fact, you're right. There were only 527 new cases on that day, and at the time, the state had a total number of cases of 47,000. The total number of deaths was just over 2,000. Since you said that basically we had succeeded, an additional 450,000 people have now tested positive, and more than 5,000 people have died. What happened?
So we got through the first phase. That was the whole point of the flatten the curve. I never said that we were not going to have to deal with the virus. It wasn't going away. Now, we didn't know when we would have to face any type of surge, but we saw it just like all the other states in our region saw it towards the end of June. But you know what? We were prepared for it. We had the systems in place. We had the resources in place. It's not been easy. Part of it is the testing. I mean, if you look at the amount of testing that's been done, it's pretty frequent. Well, we'll have 100,000 test results in a single day. We're obviously identifying a lot of asymptomatic cases. Well, I looked at Japan, and they're seeing a, quote, upsurge. They do about 20,000 tests a day. Tokyo is bigger than the whole state of Florida. We're doing 100,000. So part of the reason we've had a lot of cases, there's been an increase in prevalence, of course, but then also we've broadened the ability to test really throughout the community regardless of symptoms.
Do you think we're doing too much testing?
Well, I think that we should really focus on better turnaround times with the labs for the folks who are symptomatic or in the at-risk groups. What's happening with the asymptomatic is if you test somebody, I can't tell you whether you have live virus because you can test positive. The CDC says you can test positive for 12 weeks now. So when someone comes that's asymptomatic, it takes them a week to get the test results. They're not infectious most likely at that point, even if they were infected. So the PCR test just has limitations when you're dealing with asymptomatic people. We obviously thought that the more that we would test, we could isolate. But the labs got so backed up that in point of fact, it just didn't work that way.
And I want to come back to that in a second, but I want to just stay with the idea of the message that you sent on May 20th and whether or not your positive message that we've succeeded in basically gave people the impression that the battle was over, we had won, and that people could go about their lives again, which then also caused the resurgence to happen.
But that's okay, that's one little clip. But then what about all the actions we were taking during that time? I mean, if I thought it was over, I wouldn't have set up all the COVID-only nursing facilities. I wouldn't have done all these new test sites. I wouldn't have sent, more PPE to the nursing homes. So we continue to act and continue to prepare for the virus to resurge. And I think if you look at that time period, I mean, even all the way and through mid-June, we were doing pretty good with the COVID-only illnesses. So if it was somehow May 20th, everyone started going haywire, I mean, it's a 5-day incubation period, we would have seen it. But I do think that throughout that whole March, April period, people were trying to say that Florida didn't flatten the curve or whatever. We got through that initial hump and we're able to make the preparations. And so I think those preparations were the right thing to do. But if I thought it was over, I wouldn't have taken any of those actions, to better prepare ourselves.
When we come back, we turn to the state's unemployment system. More now of my exclusive interview with Florida Governor Ron DeSantis. Miami-Dade, Broward, Monroe County, a number of other districts have said they are not opening brick and mortar schools as they normally would at the end of August, that they will begin with online virtual classes and that they will reevaluate during the course of the semester, but they're making no guarantees of having brick and mortar open this year. Are you okay with what you have heard from those districts right now?
Well, look, the idea that we wouldn't have any brick and mortar for the rest of the year, that's not going to...
Well, doesn't the virus dictate it?
The virus does dictate it, but we should also be mindful of the trends. I mean, I think that you wouldn't want to make the decision in the middle of July when we were at our apex. So you're looking now. I think we may see some good trends. My view would be, look, be flexible. Don't get dug into not having in-person infinitum. Obviously respond to local conditions. But one of my big concerns, and we highlighted this the other day in the Tampa Bay and Clearwater, special needs students. The virtual doesn't work for special needs students. We've got to have an option for them at a minimum to have in-person instruction. I hope all districts, will try to get that done as soon as possible.
But what Miami-Dade, Broward, Monroe, and I'm not sure Palm Beach, but what the South Florida school districts have essentially said is they will evaluate, and they've given dates where they'll look at it again, at sometime in September and decide there. I just want to be clear. Are you in conflict at all with what the local school districts in South Florida have done so far?
I think we want to work with them. We understand their unique situations. I would just make sure that as long as the goal is to give the parents the choice and they're going to work to get that done as soon as they can, I don't have any rigid timetable for it because I understand their circumstances on the ground.
All right, let's turn to unemployment. Would you encourage Congress to pass reinstatement of that $600 a week check?
What I would have them do is because some of the employers will say the employees have come to them and said, look, I want to come back, but I would make less as a result of that. And I don't blame someone for doing that. I mean, why would you? I mean, that's an incentive. So maybe take the same amount of money and just convert it into a reemployment bonus. And so as people go back to work, they get the same amount of money that they would have gotten, but you don't have the disincentive. So if that's the problem, I think that there's ways you could do it. I know some people have talked about doing that.
But there aren't enough jobs for everyone who wants to go back to work right now. The state's unemployment rate is high. The number of available jobs isn't there because a number of businesses have not been able to reopen or are very open smaller.
Yes and no. I mean, I think that, well, first of all, in Florida, all businesses are open except for nightclubs and pubs. Everything else is operating. Now, maybe some businesses, obviously it's a tough environment, I get it, but there's a lot of businesses. We have homes are being sold in Florida. We've got some good indicators going on. There are needs for some jobs to do it. So look, what I would say, it's a tough time. We need to be there for people who through no fault of their own, have faced tough times. But if you can do it in a way that helps those people, but then also helps the re-entry into the workforce, if it could be structured that way, I think that would be a win-win.
So you oppose continuing of direct payments?
I didn't say I oppose it, but I say, structure it in a way so you can have the same exact amount of money, but structure it in a way that will provide an incentive to go back. And then if there's no jobs, then the person's in the same spot and they're still getting the money.
They're still getting the $600?
Yeah.
Okay, because right now, I guess one of the things that this pandemic has sort of shown is just how poor Florida's unemployment system is. I'm not even talking about the website, just the fact that our maximum benefit is $275 a week for 12 weeks. But as we look at it now, $275 for 12 weeks, nobody can live on that. Do you have friends, cousins, anyone who has lost their job and spoken to you about that and the notion of trying to survive on $275 a week?
Yeah, and I think that, well, I don't have cousins, but you have people throughout Florida that I've spoken to who were just working hard, not following the rules, and through no fault of their own, they didn't do anything wrong at their job. The economy stopped. We've never had a voluntary secession of the economy in history. I mean, we had how much did GDP go down in the second quarter?
So should Florida be doing more for those people? Can you, by executive order, increase the amount of money, the $275, which is a maximum?
So here's what we're doing, though. No, I get it, but here's how we're approaching it. So I took the CARES Act money we got. The first big disbursement I did was really a record $250 million for affordable housing. Rental assistance, mortgage assistance, so people are able to stay in their homes. Now, we obviously suspended evictions and foreclosures through, I think, the beginning of September. But putting that money there, those are exactly the types of people we're trying to help. Also, I mean, I've resisted calls to shut down the state because I think having society function puts us in a better posture to handle the pandemic. But I'm also mindful of the second order effects of this. So we've been able to, our unemployment rate is high, but it's lower than what people thought it was going to be, 10.7%. Businesses are operating. The more we can get that going, particularly as we get on the other side of this hump, hopefully, then we're going to be able to put more people back to work. So part of it is the unemployment, I get that, but part of it is some of these other things that we've done, and that $250 million for the affordable housing, that's going to be a huge, huge shot in the arm for a lot of low-income families.
But let's stick with the $275. Do you think that number should be raised?
I would look at it. I don't think I can unilaterally do it. I think we would have to have the legislature come in and be able to...
Why not call a special session to examine it? I mean, people are right now only going to get at most $275, regardless of what.
Well, first of all, there will definitely be more federal assistance. Even apart from the unemployment, I can tell you there's going to be another $1,200 most likely that's going to go out to folks, and there is going to be some form of a federal unemployment supplement. So I'm going to look to see what happens with that. Look, if we need to act in Florida, I'll be happy to do it. But at the end of the day, there is going to be a Phase 4 package from the federal government. I'm not in the Congress anymore, thankfully, but I know that something's going to come down the pike.
I want to be clear. The website, the unemployment system website, was not under your administration. It was under previous administrations. In fact, as I understand it, this website, which has proven dismal, I think you referred to it as jalopy, cost the state $77 million, with $56 million going to Deloitte. Should the state be looking to file a lawsuit to try to get some of that money back?
So the Inspector General, I had her invest, so that's underway. We're going to take a look at that and then figure out, what we have to do. Now, the system was obviously problematic, and so you had to beef it up and do all that. So there was a lot that was done to fortify and re-engineer the system. I also brought like 2,000 state employees from other agencies to do all hands on deck approach, and I think now we've paid out close to $13 billion since then. But man, from the end of fourth week of March through most of April, we were in really dire straits with that system. So I do think we should get the results of the IG, and then if there needs to be some type of suit or some type of accountability, we absolutely need to do it. I mean, my thing is like a lot of these unemployment systems throughout the country, weren't very good, but a lot of them are like 40, 50 years old. Ours wasn't really old. I mean, ours was really 5, 6 years ago, and it should have been done better for that price tag to produce better results.
It was set up, as I understand it, to handle no more than 1,000 claims at a time. 2,500
surge capacity.
Right? You don't build a system like that for good times. You build it for cataclysmic times. You build it for worst case scenario. Do you believe that the system was in part put together the way it was to discourage people from being able to collect
unemployment? I think that was the animating philosophy. I mean, having studied how it was internally constructed, I think the goal was, for whoever designed it, was let's put as many kind of pointless roadblocks along the way so people just say, oh, the hell with it, I'm not going to do that. And, for me, let's decide on what the benefit is and let's get it out as efficiently as possible. We shouldn't necessarily do these roadblocks to do it. So we have cleared a lot of those, and I waived a lot of requirements through executive order. But I think going forward, I want all our systems, including unemployment, to be user-friendly, and it was not user-friendly.
Well, that system was designed and implemented during the Rick Scott administration. Do you think that was Rick Scott's intention, was to discourage people from applying for benefits?
I'm not sure if it was his, but I think definitely in terms of how it was internally constructed, it was definitely done in a way to lead to the least number of claims being paid out.
Now, there was an audit that came out in 2019, I believe, that pointed out many of the flaws. Should you be held responsible for not having acted on that audit and corrected this system?
Well, so that was an audit that was given to the agency head. Nothing ever reached my desk. I was not asked to do anything. I wasn't asked to seek more funding from the legislature. If I was, I probably would have done it. But I looked at that audit, and honestly, that does not answer really the systemic flaws that was evinced with this thing. And so even if those things were done, and they should have been done by the agency, we still would have had the same problems.
We're all optimistic or hopeful that we're going to have a vaccine sooner than later, possibly by the end of the year. Have you given any thought at all to the issue of the vaccine and how it should be distributed?
So certainly elderly should be first in line, without question. And then other people who have some of the key medical conditions should be first in line. And I think that's regardless of community, and that should be the case. So people have asked me like, oh, are you going to get like the vaccine first? No, I'm gonna defer. Those folks should be first in line, not me. And so that's really where we're going to focus.
Last question on vaccine. Should immigration status play any role in whether or not a person gets a vaccine?
No.
After the unemployment portion of our interview aired earlier this week, Senator Rick Scott fired back at DeSantis, saying, some people, they take responsibility, some people just blame others. It should also be noted that Deloitte, the company that installed the unemployment website and made tens of millions of dollars from it, is now in line to get a $135 million state contract to manage the Medicaid system. We'll be right back. Thanks for joining us. You can email me at jdefede@cbs.com or follow me on Twitter @DeFede. We'll be back again next Sunday. Until then, stay safe and enjoy the rest of your weekend.